what can you offer, even in an abstract sense, to therapists who maybe find themselves a bit disappointed with their work or challenged by emotional burdens or what have you? Something's off and not working, and not feeling flowy.
There's always days like that. Not always whole days even. There's always those clients or those patients where you feel, I don't get them, or they don't get me, or we're not meeting in the way I would have hoped. We're not feeling each other. And then I fall out of flow when that happens.
Yeah.
It doesn't happen that often, but there are some that come and go. So what do? I really turn back and listen into myself and say, look, what's our human commonality, and try to keep focusing on that. We all want to love and be loved. We all want to find a sense of meaning and purpose. So let me just listen in to what I'm hearing from them about those. What are the little clues, hints about those big issues? Because if I can't grasp onto their smaller, more specific stuff that they've come for, at least maybe I can get a hook onto one of those bigger, overarching kind of places and find a way in from there. I also do look for the images that are coming to me, because they might give me a clue of how to connect and how to get back in flow with this person. So that's specifically about the person. In my own life, I need to give myself time to write. I need to give myself time to do all the things I enjoy. So I can't work too much. I think our work is so important, so intense. And someone just said to me yesterday, my goodness, we got so much done in 50 minutes. I can't believe how much we talked about and how much my mind kind of felt like it was expanding in 50 little minutes. And I said, I know, that was a lot of things. There were practical skills we did some breathing. We talked about real skills in social anxiety relief in social situations. And then we went back and talked about past trauma that we had talked about in previous sessions, and had to talk about how she was going with the processing of that, how what she had written down about her processing in a narrative therapy kind of sense that she had to share with me. And we went through the insights from that little bit of writing she'd done. So all this was packed into 50 little minutes, and I think her head was spinning a little bit. So we work so hard that that I think we need to watch how many hours we work. And of course there's practical issues, but if we can make sure we get to supervision, have groups like this where we can talk with other therapists, it's incredibly supportive. It's vital, really. It's absolutely vital. And not be too intensively packed in our schedule with one-to-ones. I think you've got to have a breath, and you know what you can handle after a while. Once you've experimented, don't you? You know how many in a row you can handle on a day. Yeah.
Thank you for that.
Got to be very mindful of your load. Yeah.
And the way that you present it, I appreciate the fact that it's local, but then also large. So the idea of, why am I out of flow with this person, or even taking it somewhere else? Why am I out of flow with this activity or with this situation, or in my relationship with a thing rather than a person? Or maybe it is larger. Am I out of flow in an area, and what does that look like? So I appreciate that about the book, and just your tips, that it can be really specific, where sometimes we make something global, that there's no need to do that. It's really about this area or this thing or this person.